Osteoarthritis is the most common cause of disability in the world, and osteoarthritis is the most common form of arthritis. Arthritis is inflammation of joint. Osteoarthritis affects around 10% of men and 13% of women more than 60 years old. And what is osteoarthritis itself? It's breakdown of cartilage, and cartilage is cushioning materials on the bone, between bones. You can see it is joint of knee, and you can see this cushioning materials is cartilage, and its breakdown over time is osteoarthritis. It's chronic process and develops slowly over years. Most commonly affected parts of osteoarthritis is knees, hips, spine, and hands. Usually it affects major and large joints. And what is the most important symptoms? Most important symptom is pain, which worsens during weight-bearing activity and easy at rest. So morning stiffness is important also, but this morning stiffness should not last more than 30 minutes. So morning stiffness is important symptom. Pain associated with physical activity or weight-bearing activity is important symptom. And limited range of motion, also important symptom. Sometimes joint swelling, crunching sensation during joint movement. Patients usually remember this crunching sensation during motion. And if we want analogy of osteoarthritis, it looks like car tires. When car tires are wearing and they are not replaced, sometimes when these tires will wear fully, car have to move on its metal rims. So it means when bones directly touch each other and no cushioning materials anymore, and there is direct contact, it's analogy of a car without tires. And when car is driving on its metal rims directly on the ground, and of course it's not comfortable, it causes damaging of car, and it causes pain in this case of person. What is diagnosis? Diagnosis, of course, physical examination, of course this diagnostic criteria such as pain which worsens during weight-bearing activities and which lessen during rest, morning stiffness, limited range of motion of joint, and on imaging, X-ray or computed tomography, we can see narrowing of joint space. You can see this narrowing of joint space, and also bone spars or osteophytes. Osteophytes are growing of bones. So bone material grows because there is no cartilage already, and it's broken down and it's lost over time. That's why bones are growing, and it is called bone spars on imaging, usually on X-ray or CT scan. So what is differential diagnosis? Differential diagnosis is with rheumatoid arthritis, psoriatic arthritis, and gout. But because of osteoarthritis has classical symptoms, it's relatively easy to diagnose, and it's associated with age, of course. Now let's say about treatment. What is a treatment? First line treatment is lifestyle modification, like weight loss, physical activity, physical therapy, ibuprofen and naproxen, non-steroidals. And second line treatment, if first line treatment fails and not effective or not enough, then second line treatment are used. Second line treatment can be more stronger non-steroidal, such as tramadol, sometimes opioids also, or injections of corticosteroids or hyaluronic acid directly into joint. It's also a type of treatment, and it has some effectiveness. And what is prognosis? It's chronic disease. It's progressive over time. When cartilage is broken down and lost, it will not recover. So it will not improve over time, but we can manage symptoms. And 80% of patients will have some limitations in the activity, and 25% of patients will have major limitations in daily activities. So that's why osteoarthritis major cause of disabilities in the world. That's why. And if person says that he has joint pain or joint stiffness, first we think about osteoarthritis. Thank you for your interest. Thank you for your watching. If you like my videos, please thumbs up. If you like my channel, please subscribe. Thank you very much. Bye for now.